Now that we have reviewed the features of this webinar, I would like to introduce our presenters today, Datavox's Vice President of Audiovisual, John Layton, CTS, and our Human Resources Director, Christy Hatfield, SPHR. John and Christy, the floor is yours.
Thank you, Jessica. Thanks for everybody for joining us today. We will take this time to discuss our experiences in dealing with COVID-19 and what worked for us and what didn't work for us. Our hope is that you will find this information helpful as your business returns to the office. And following this session, you will receive a survey with the opportunity to request a one-on-one conversation with Christy or myself. As a disclaimer, this presentation is not intended to constitute legal advice, and you are encouraged to consult your attorney or relevant experts as it applies to your business. And with that, let's get started. So we're going to start with a little bit of data about who's attending today. And as it stands right now, 7% of you have indicated that you are open fully for business. 48% of you are at limited capacity, and 45% of you have not reopened your facilities yet. So still some pretty interesting numbers, especially considering where we are at. And we hope that, again, this information will be useful and help you transition and reopening your facility. So let's start with a timeline review, a brief timeline review of the last year. So we all know that COVID really took off March 2020, so a year ago, just over a year ago. And it was really a rapid pace at the beginning. So March 5th, Datavox formed our COVID response team. We'll talk more about that throughout the session today and how that was critical to us in dealing with COVID and responding to it. And I think the next event of significance for all of us in this area anyway, that really signified how critical this situation was when on March 11th last year, when Houston Livestock Show and Rodeo was canceled midstream. I think there was a big wake-up call to everybody that, wait a minute, this is really, truly serious if they're canceling that event, because we all know what that means to the region, to students, and to the economy in general for Houston. Texas universities and colleges moved to online almost immediately once that happened. That was also a big indicator that in-person meetings were really going to be curtailed, and the lockdown had begun. March 12th, Datavox, we had our first COVID-19 briefing with our EMC, and we'll talk about what that means for us a little bit more detail as we get further into the presentation. Really, a little over 2 weeks later, we began a transition to work from home for Datavox. The majority of our personnel started working from home. And then at the end of March last year, Governor Abbott, that's when he first told Texans to stay home, basically until May 4th. So critical infrastructure support organizations, of which Datavox is, were exempt from that order. And that is one reason why we were able to remain open throughout the last year. And we'll dive into that a little bit deeper as well. So April, that gave us a month to kind of prepare our office to accommodate the new protocols for social distancing, for infection prevention, and some other things that we did to prepare our space. And we'll talk about that as well when we talk about facilities in this webinar. And then employee testing in April was still taking days. If you remember back, getting tested was really hard at the beginning. Facilities were just not prepared for it. And having a plan to get your employees tested so you can return them to work when they're negative is really, really important. Weekly COVID-19 update begins. We started communicating with our employees on a weekly basis, providing them full transparency as to what we were experiencing, what our numbers were, and what our plans were in dealing with this, and what our plans were to keep employees safe. And then we get to May, again, May 4th, as soon as we were allowed, we reopened the facility. No more than 50% capacity, but reality, we were probably about 30% in May when we started that. And then employee testing was still taking days. And we continued our weekly COVID-19 updates and employee town hall calls, all about communicating with employees on a regular, consistent basis. Moving through the year, we get to June, no real improvement in testing. It was still taking a number of days to get results for people. We continued our communication protocols and with the weekly updates and town hall calls. adapted those and applied or added additional when it was necessary based on the circumstances that were happening. And then a big date for us was June 22nd. We had developed and released an employee screening app. It was a daily survey that was automatically sent to employees, allowed us to get information and understand where employees were, what their health status was. And we'll talk a little bit more about concerns about tracking employee data and some of the things that prior to the pandemic were really frowned upon by HR and those types of things. And quite frankly, employees had concerns over that data when we first started. July 2020 was a big moment for us in that we established an agreement with the Houston Area Safety Council to provide testing for our employees. And we were able to easily schedule testing, a request for an employee, and usually the next day we could have an employee tested and have results within half an hour to an hour. That allows us to react quickly to potential exposure and get employees back to work quickly. Weekly COVID updates, we continued through July. If you remember, we had a big spike in July, so that was an important piece, keeping employees informed as to what was going on, and so that they felt comfortable and knew that we were managing the situation, that we were on top of what was going on in the region as well. August, kind of things started to settle out a little bit. COVID updates moved to a monthly kind of cadence. We slowed that down a little bit. And then following throughout the fall, the same thing. November, we established a formal travel policy that was probably in big part due to Thanksgiving holiday coming up. And we knew we had employees that wanted to travel that hadn't seen family in 9 months. And we wanted to have a plan in place where it was clear for them what to expect when they return. And then we get to 2021, returning to the office, right? Is your facility prepared for that? And that's what we're here to discuss a little bit today. And then, the mask mandate has been rescinded, at least government-ordered mask mandates. But are your employees ready for that? And how comfortable do they feel working in that environment? And then what do you intend to do in your business? Just because the government can't mandate it doesn't mean businesses aren't deciding that they still want to continue that mask policy, and employees may expect that at this point. So moving through that, let's talk a little bit about Datavox. I mentioned earlier critical infrastructure business, of which we're classed. And we earn that designation because we provide services to other entities, whether that be local, state, government entities, hospitals, other critical businesses that were vitally important to supporting the area as we dealt with that crisis. So we were fortunate to be classed as that type of business, and that allowed us to stay open. We also established our COVID team, as I indicated, March 5th. That was a really big step for us, very important to our overall success. And our COVID team has membership from executive, from legal, from human resources, and from operations. We wanted a voice from all aspects of the business so that we made sure we were in tune with what our employees were seeing and feeling throughout the process. We reviewed guidance on a regular basis, and initially the guidance was changing rapidly, almost every day, from CDC, federal, state, local authorities. We had to consider OSHA, ADA, GINA, HIPAA, all sorts of compliance ideas or regulations that had to be considered when you're looking to open up your facility. And then we relied on trusted resources, our insurance brokers, employment attorneys, SHRM resources, and others who were also reviewing the mandates and kind of coming to a consensus about how to interpret government regulations or guidance and what was considered best practices in relating to those entities. So the next item that was fortunate for us is a business continuity plan. We have a business continuity plan as an organization, as a support organization. And our primary business continuity plan is all built around responding to hurricanes. That's the biggest threat we face in this region on an annual basis. But we were fortunate that our plan actually included a section on pandemic response. We'd hoped we never needed that, but unfortunately we did, and we're fortunate that we had it in our plan. So a couple of things about a business continuity plan. Our business infrastructure was already built based on that BCP to support a remote workforce. So we can immediately transition to a remote workforce. We had to be prepared for that during hurricane season because you never know when the storms are going to come, when you're going to have to shut down, work remote, and then return to work and support customers. Part of our BCP involves annual testing of our remote workforce. So we do that annually, and March just happens to be the month where we do it to prepare for hurricane season, which starts June 1. So we were in the midst of just spinning up testing when COVID struck. So we accelerated our testing just to make sure all our employees were ready to work remote. And that was a vital benefit for us to be able to be in that position. We realize a lot of businesses are not as fortunate as us being a technology company. It really made things easier for us. So part of that business continuity plan, we engaged our frontline managers or our emergency management committee members, as I mentioned earlier, to assist with certain aspects of that plan. They were responsible for their department or their team. Is your workforce and your team members ready to work remotely? What do they need? What didn't work during the test? And they worked with our IT support staff to correct those deficiencies. So our COVID team was able to focus on the bigger picture while those guys focused on the details of the individuals involved.
Yeah, and so to add a comment there, as we go through and talk about our experience, it's really to say, here's some key things I think that helped us be successful. So if you have your small takeaway homework list, one was a BCP. Large organizations are going to have that in place. Smaller ones may not, or ones that don't provide service. But we were able to, in a day's time, go to a remote workforce because we had it established. We tested it regularly, updated on an annual basis. So that was really key. We had next to no downtime, where I know friends and peers at other organizations, had a week or more where their IT department was scrambling. So that was really key. And also with establishing a COVID team, it allowed us to metabolize the information that was coming very quickly, and then interpret and verify with available resources. And that helped us move really rapidly, as opposed to expanding the COVID team to our entire management group, which would have bogged down the process.
Yeah, too many voices sometimes can give you, make you paralyzed in making a decision because you got too many people contributing to that. So the other thing about Datavox, really quickly, we've got a split workforce. We have office personnel, if you will, and we have field personnel, people that hardly ever come to the office. So how do we keep both of those workforces safe? That was really important for us, figuring out a plan there. And then, as I mentioned before, we were able to remain open throughout the pandemic. The region and really the country in general, construction sites never closed during COVID, which was a critical component to keeping the economy going and not completely grinding to a halt. So with that in mind, the general contractors that are running these construction sites, they had to adopt rapidly to COVID-19 working conditions, and they did so. And I can't speak highly enough about the general contractors and projects that we worked on and what a great job they did responding and keeping their job sites safe. Because the last thing they wanted was to have to shut down a job site because of COVID spreading throughout that workplace. And then, of course, we have internal IT resources and supports to support our staff. So for us as an organization, it made it a little bit easier for us to deal with COVID, where some organizations rely on outsourced resources or have a small IT team that just was not prepared to deal with the sudden shift in working from home. So I think the next topic we wanted to touch on this was paramount to our success was communications. Having fully transparent and consistent communications with our employees and our customers was vital to our success there. One of the first things we did was establish an email alias. So we made it easy for employees to send an email. Here's where you send it. Don't send it to an individual. Don't send it to this group. The COVID team was members of that email list. And so, number one, that gave us the ability to track all requests that were coming in and for everybody to see them. We had people on the email list, a couple of the executives that were in the COVID team. They never responded to an email, but they were constantly in the loop about what was going on with employees, what the employees' temperature was, who was nervous, concerns that employees were were experiencing. And that helped us manage the situation, just keeping everybody in the loop on the COVID team. And that employees quickly realized that was an easy way for them to report concerns and know that those concerns were private, that we took their HIPAA compliance seriously, and information was shared strictly on a need-to-know basis. We'll talk a little bit more about HIPAA when we get to personnel. Christy can kind of address that. The other thing that we did from a communications perspective is that we defined tasks and roles for communications. Christy assumed the primary role for responding to internal communications and requests for employees. That was the right voice. Human resources needs to handle employees' concerns and requests. And I assumed the role of dealing with customers and general contractors if we had a positive case or we got notification from a GC that they had a case on a job site. And then handling those consistently, and our ability to handle those evolved throughout the year. We definitely got better at it as time went on, and really established a routine, and it made it much easier for us to move forward. We use several technologies for communications. Email, obviously, as we talked about, and Formacast messaging. So we utilize, and we have for decades, a solution in-house for mass communication to our employees, a solution called Formacast. Makes it very easy for us to communicate immediately with employees. We limit who has the ability to send those messages because we don't want just anybody doing it, but we utilize that during hurricane season. We used it a few weeks ago when we had the big freeze, right? And an immediate way to say, everybody's working from home today. No one would report to the office. Road conditions are unsafe. Those types of things. So, and that Formacast allows us to communicate via text message, via email, or voice, even a voice notification to employees. And it's very easy for us to send it. So that was a really important part, especially with our split workforce, Christy, because we have field personnel that don't regularly sit in front of a computer or check their email. So
yeah, as I was going to mention, we have an extremely diverse workforce. We have those that are in construction sites that don't check their phone all day. And we have employees that are at their desk in their email, for 8 hours. And how we reach those employees is different, but we wanted the same uniform message. So we took every application and technology that we had available to us to give them multiple mediums to receive the same message. And we needed it to get in front of them. We needed them to read it. We're probably all familiar with the one email that goes out and never gets read. And so we wanted to make sure that this message was consistent and thorough and frequent.
Yeah.
I think we were able to do that.
Sure. And then we leveraged, as much as we're doing today, Mike, our WebEx for town hall meetings. We did a very consistent, we believe, a very consistent approach to our employees. Like we said, multiple methods of communication. We would send out emails when there were big changes to policies. We would hold town hall calls, and we would talk through those changes and announce them and explain them to our employees, and then give them the ability to Q&A and ask questions or submit questions later to get clarification and understand why we were making the decisions we were making and support those. Sometimes people will read an email and it's like, I don't understand. What justification do you have for making that policy change? So it was important for them to hear a voice, not just read a message. So that was really important to us. Messaging to our customers, obviously, we did that immediately, that we are open, we are available to support you, and we will remain open and available to support you. And establishing a cadence of messages, a consistency to what we were doing when we were communicating with employees, and then having a consistent voice from leadership, right? The same person ran the town hall meetings, the same person that was sending the weekly email updates. People got used to seeing that one person's voice and knew, I don't normally ever hear from this individual, but when I do, I know it's COVID related now, and it's something I need to stop and read and listen to. And then the other thing that we did communication-wise, right, as a technology company, we've got digital signage throughout our facility, but even digital signage wasn't enough to consistently convey the message. So we did a lot of printed signs and updated signs and posting in every conference room what the capacity limits were, what the social distancing protocols and hand washing and all these types of things that people needed to do, because we realized that you have to reinforce it consistently with your employees. Otherwise, it's very easy to forget and get lackadaisical.
Yeah. And so to add on communication piece, very first bullet was establishing our email alias. Everyone's familiar with sending in a request to the black hole and never getting something back, right? And so to encourage employees to continue to send everything to us, concerns, suggestions, maybe things at home personally that are COVID related. We were on top of every email that came in and timely with response. And that was telling our employees, hey, we're seeing your concerns, we're addressing them. Even if we didn't have a response right then, I hear what you're saying, let me bring this back to the team and review. And so the rapid response and the seeing of their concerns created buy-in with our employees that we were taking their safety seriously, and it kept them engaged with us, which helped us evolve as we returned to the office.
Absolutely. So moving on, let's talk about your facilities and our facility and what we did. As we indicated before, we never really closed. So we operated really, as soon as the order came down to go home on March 31st, we cut back to about, I would say, maybe 10, 20% capacity at the office. And we had the ability to measure that capacity because we've got occupancy sensors. We're fortunate we had these installed prior to COVID, but it allowed us to leverage and know how many employees we have in the building. We did make some changes to traffic flow, ingress and egress points for the building. We limited it down to our main entrance at the front door and our main employee entrance, and we locked down all the other ways to enter the building so that we could accurately track how many people we had and what our occupancy was in the building at any given time. It also allowed us that defining traffic flow. So we knew that when people were coming in, we had them stop at a temperature screening station. They had the ability to sanitize their hands. And we even instituted for our employee badges a colored dot system. Every day it was a different colored dot. So you could see if a coworker checked their temperature this morning and those types of things. So that helped our employees feel comfortable with the facility, that it was prepared and that we were managing it daily with employee safety in mind. The other thing that we were able to do during that month of April was reconfigure our workspaces and our office in general to support the quote 6-foot office. Very early on, there was guidance given by a lot of groups about how do you do this. And Cushman Wakefield is one that sticks out to me. They produced a document about the 6-foot office and things you could do to prepare your existing space and to go buy new office furniture. How do you get it ready? And so we spent a good amount of time during the month of April preparing the office for our return on May 4th. And that included, moving seating and realigning desks, staggering desk positions, and actually removing chairs where we didn't want people to sit, so that we were enforcing the 6-foot rule for employees when they sat and came back to the office. We also empowered our frontline managers, or our EMC team, to handle managing their workforce and defining shift schedules, right? We're blessed with a very talented management group, even our frontline managers especially, and they know what it takes to run their team. They knew their workforce, who could work these days, who needed to work from home. Because as we'll talk a little bit further when we get to personnel, right? There were all kinds of varied circumstances that people were dealing with through this. And so you had to have a way to deal with that. And when you've got almost 300 employees, you can't have a single, even HR can't handle the day-to-day minutia of every employee and what their concerns are. So we passed that task down with clear guidelines to our managers and how they could address it. We also took that opportunity to update our meeting space, occupancy limits based on social distancing guidelines. We established cleaning protocols for meeting areas, for copiers, for common areas. We changed our food policy. Communal food was no longer allowed. You can't have pizza or boxes of donuts, right? It's what you may still be able to have a meeting, socially distanced, albeit with 15 people in the room for training, but you didn't want 15 people all reaching into the same box of donuts, and then you have somebody test positive, and now all of a sudden everybody's got to be quarantined that was in that meeting, whereas otherwise there would have been social distancing and you didn't have to quarantine everybody. So things like that, that, we didn't think of at first, but we immediately went to. And the same stuff we saw in restaurants, right? Salt and pepper shakers are off the table. There was no, you can't just pick up silverware at the, it's individually wrapped type stuff that you had to go to. We also updated signage throughout our facility. We have both digital signage, as I alluded to earlier, and paper signage that was placed all over the place, so that it was clear to everybody what was expected, what the requirements were, and it made it easy for people to remember what they needed to do to stay safe. We also provided hand sanitizer for all our employees at every desk, in conference rooms, and restrooms, right? So we provided those supplies. Initially that was a challenge, that stuff went off the shelves in a heartbeat, and it was hard to get supplies. And so we had employees saying, well, I can't get hand sanitizer. I can't find any. I don't want to come to work. It's okay. We have the supplies for you. We'll take care of that and provide that for you so you can work and feel safe when you're at work. Masks and gloves were the same thing. We provide those at the front desk because we currently have a mask policy. When you're up walking about the office, you need to have a mask on. So we provide that for those that did not have them or just needed a new one today. They don't last forever. And then, of course, we have a visitor management system, and another tool that we leverage for keeping not only visitors but our employees safe. And so our visitor management solution, when we have a meeting scheduled, and we've been still having meetings, albeit fewer over the last year, but still have customers, suppliers, those types of things that would come into the building for meeting. But that visitor management system set out notification ahead of time to visitors saying, hey, here's our policy, masks are required. And it also conducted a survey about, have you been exposed to anyone that's tested positive? Are you showing any symptoms? So visitors were clearly aware of what was going on, and it sped up the process when they did arrive. It's a no touch, here's a badge, put this on, and you're clear to go. And that really eliminated a lot of what I think could have been contentious arrivals when people, individuals have individual or personal beliefs about masks and their effectiveness. They've had it throughout the whole year, and but as a business, you have every right, even though mask mandates have been rescinded in Texas, businesses still have the right to enforce whatever policy they deem fit for their environment. So I think that's important.
Right. So I was going to say, some of this may seem overzealous or not applicable in the temperature of society and COVID and where it stands now. And that may be true, but in order to ensure that your employees are safe and your employees also feel that you're taking action to keep them safe, some of this, served a dual purpose. One, yes, to inform them of policy, but also give them the physical, visual reminder that we were doing things here at the office actively every day to keep them safe. From establishing a cleaning protocol, but posting that cleaning protocol right next to the copy machine or the microwave or whatever it is. Posting signs in every conference room that this is the limited capacity. The spacing in the office.
Yeah.
When you sit down and you recognize that the person that normally used to sit next to you is now more than 6 feet away, right, gives you that reassurance. And with 50% of you not having your workforce in at all, there's going to take some time for them to reacclimate, not just being near someone, which social distancing is still a requirement now, but just seeing people in an office and being in a community space with those that they probably haven't seen in a year. So with that in mind, a lot of these things, although may not be necessary to an extreme degree, may still have some place in your business, depending upon how your employees are feeling.
So the other thing I would say as we close on the facilities piece of this, and we move on to personnel next, is that we know what we did worked, right? We were fortunate that we've made it through the last year with no office transmission of COVID-19. And that's not to say that we didn't have cases of COVID-19, but we know that through contact tracing that those cases came in from outside exposure, not within the office. So we're very proud of that fact. And again, we know that what we did worked for us. So hopefully some of these things can help you as you reopen your space or go back to full capacity. So, Christy, you want to talk about personnel challenges and some of the things we dealt with?
Yeah, absolutely. So I mean, obviously a big part of your business is your people that make your business move forward. So although there's things that we want to do for our business, you have to consider the people that make the business run, right? And having Datavox having an extremely diverse workforce, we had to consider multiple views on the pandemic. I think everyone has their own opinion about it, and be cognizant of that when asking people to return to work. It could be that they have an elderly family member that lives with them, or it could be that the employee had a medical condition that they never had to disclose before because it didn't impair their ability to do their job. But now, because of the pandemic, they have concerns about exposure and heightened risk. So, we created I'll say, overarching policy about how we were going to manage our people and what type of expectation we had for a return with capacity and those types of things. But then we had to empower our managers to say, okay, you work through each of your individual groups. If someone says, hey, I have a problem with this, we need to have a further discussion. We couldn't have one policy that fits all, right? Because in a critical time, you don't want to lose critical resources. And so having a hard and fast rule when someone may have a true reason that we can hopefully accommodate with the right technology, we needed to work through that. So that, we empowered our managers to do that, and also gave them resources in HR to help facilitate those conversations and not wing it on their own. One of those things was a remote work policy. There was a lot of questions about, well, what if this person, I don't want them working remote. This job isn't a job that can be remote, or maybe they don't have the right setup to work remote. But so we created a policy that had some flexibility, but it established some basic functions about working remote: bandwidth, computer setup, productivity. And then from there, the manager was able to apply it as necessary based upon the job function. So there was a lot of questions about that early on when certain jobs really needed to be in the office.
Yeah, and I think we all witnessed it through the time. Some people are better equipped to work from home just because of their space. Maybe they do have a dedicated office. Maybe they do have, or they were able to make a space that was conducive to working remotely, whereas we've all had somebody that was on a meeting that was sitting on their bed, right? Or they're in their kitchen and the kids are running around behind them because the kids couldn't go to school. And so, it made it noisy to try to have a meeting. And so you're still, in some cases, still dealing with those types of things. So having a policy that, somebody's got to be able to work effectively if they're going to work remotely. And that was really key to what we were doing. So.
Right. So, some of you are probably very familiar with this, and some of you are probably not at all, but we stressed HIPAA with employees quite a bit, and that's just a part of the alphabet soup that HR people have to deal with. But disclosing individuals' personal health information for any reason is not permitted. And in a natural disaster, generally when it's one we deal with, like a hurricane or something like that, that's not a factor, but a pandemic is medically related. So we consciously talked about this in every town hall meeting, that everybody's individual personal health is private, and we will not share who it is or any of the circumstances around their conditions. And we made sure that managers were in tune with that. We counseled employees on that because we wanted to make sure that everyone had their privacy and their rights protected.
Yeah, and they felt comfortable sharing information because they knew it wouldn't be disclosed randomly. And I think that was a very important part of it for the comfort of employees, as Christy alluded to.
Yeah.
If I can, we had scenarios where, someone's positive, and we even had people initially, well, who was it? Who was it? Can't tell you. Right. But you also have employees that are good friends, and an employee may disclose that information on their own to coworkers. That's fine. That's their information. They wanted to share it, or they shared it on their own. But Datavox never disclosed to anybody else, except for an executive need-to-know basis, where it was paramount to continuing to run the business.
Yeah. So. And so I was going to say, where we are now, and probably also in the summertime a little bit, everyone experienced COVID fatigue. we're over it. It's hot. I live in Texas. I don't want a mask on.
Right.
But we had to remind people to stay vigilant. And we did that through our regular cadence and communication, talking about infection rate numbers at our business that supported the fact that these additional steps, whether they were burdensome to you or you did or did not disagree with them, were working in our organization. And that, I think, kept people engaged with us.
Yeah.
And they did require some reminders. But, I think we're all.
Yeah, by and large, our workforce has been phenomenal throughout this process, and we've been blessed with that. So moving on to infection prevention, another key cornerstone of what we did is that, having an infection prevention plan for your facility was really paramount to being successful, right? And when you build that plan, you really have to think outside of your personal beliefs. You've got to put the interest of all your employees and, if you'll forgive the parlance, the science into your decisions and your plan. Constantly reinforcing those protocols, right, to your employees was important. We did that by digital signage, by paper signage, and we're talking about the protocols for hand washing, social distancing, face coverings, communal food, and having a no-touch office. We're all generally social creatures by nature, and not being able to do a handshake with somebody is really strange for the last year. Looking to shake hands with people is really, really important.
Getting used to
me.
the elbow.
Getting used to the elbow with other ways to greet people, definitely a challenge. But I look forward to the day when we can get back to shaking hands. So the other thing we did as far as infection prevention, we've talked about this before, but providing supplies for employees. We didn't want someone to have an excuse that, well, I can't come to work because I don't have sanitizer, I don't have a mask, we wanted to eliminate those barriers for people so that, number one, they felt comfortable and they were protected. Having our workforce protected was really important and allowed us to keep operating throughout this last year. So, we even had scenarios when you're in a construction site. I remember last summer, we had a project we were working on, a 28-story building, and it was still a core and shell at the time. So there was no running water. There was hardly any electricity in the facility, save for the freight elevator that might go up and down. But it took, can you imagine working on the 26th floor and you need to wash your hands because it's lunchtime? You had to walk down 26th flight. You can't do that, right? So preparing people with 5-gallon jugs and soap to be able to wash their hands wherever they were in that facility was really important for us. And then, we did things like restrict ride sharing in company vehicles. Close contact was something we were trying to avoid with people. So very important there as well. Surface exposure. If you remember in the beginning, there was a lot of concern about, okay, if you touched a surface could carry the virus for a week. I mean, it went from 24 hours. No, it's 48. Oh, it's 72. Oh, it could be as long as a week. You really don't hear too much about surface transmission now. While I'm sure it's still a concern, it doesn't get nearly the amount of media attention, if you will, that it did at the beginning. So trying to address those things is important too.
I think there's still some concern with air quality.
Yes.
Which there's solutions out there that can help with that, but surface area maybe not quite as much, or not discussed in the news. You're right.
Yeah, exactly. It just doesn't get the policy. So, we started as part of our infection prevention was that daily health screening that we were doing. We wanted to know, and we were constantly reminding employees every day, if you're sick, don't report to work, right? Contact your supervisor, get guidance. And the reality of it is I have a headache today. People get headaches all the time. It has nothing to do with COVID, but trying to understand and people were rightly confused. I have a headache and a sore throat. Do I have COVID? Well, initially people weren't sure what that meant. And so trying to understand and navigate through that is a challenge. And having guidance for your employees on what to do. And, like we said, contact your supervisor. Well, if the supervisor didn't know what to do, they would contact the COVID team. What do we need to do in this case for this individual? And so we would address it appropriately.
And so in our infection prevention, I was really the first line person with responding. I'm not a doctor. I wasn't trying to be a doctor, right?
Absolutely.
And a lot of times what I was doing was counseling the employee about what COVID symptoms are, and then asking them to evaluate where they've been. Have they participated in an activity that was in a group setting? You know, are these symptoms normal for you? And just talking through it with them for them to determine if they should stay home. And we always ask them to err on the side of caution. For some employees, but depending upon their job function, that was easy. But for our field workers that had to be physically on site, missing hours was tough. So we tried to be really cognizant of that when talking through employees, but also needing to keep our other workers safe. We didn't want to shut down an entire job site.
Yeah, and I would say, as I mentioned before, we can't give enough credit to our employees because, as Christy said, we had people that worked in the field that had to be on site to work, and a lot of these people are hourly people. Well, they know if they don't go to work, they don't have a paycheck, and so for them to have to be cognizant enough to balance their need for work versus their coworker safety. Our staff did a fantastic job in balancing that because we know sometimes those decisions are not easy. People need a paycheck, you got to put food on the table to feed their family. But our employees did a great job dealing and making the right decisions. You know, the other thing I would touch on here in Invention is having a travel policy. Really, really important to have a defined travel policy. And as we see some of the guidelines changing now, you know, you'll see whether or not you want to adopt that. But even as it stands right now, the guidance from CDC is conflicting in terms of fully vaccinated people. If you look at the guidance now, if you're fully vaccinated and you've been exposed to someone with COVID-19, you don't need to quarantine anymore. However, the guidance still says if you travel, even though you're fully vaccinated, if you travel via air, and you may or may not have been exposed to somebody when you travel by air, no one knows, they still want you to quarantine when you return. But if I'm fully vaccinated and I was next to somebody who was positive, why do I have to quarantine when I don't know if I was next to somebody positive? So there's some conflicting information out there. So you've got to make a policy that fits your business, but also informs your employees this is what to expect when you travel, because summer's coming. People are going to start traveling again if they're not already. You probably just had people that were traveling for spring break, went to see family, took the family somewhere. What was the policy? What was required when they came back from that travel? And be consistent in your enforcement of that. I think that's one of the other things that was really important to us was consistency from top to bottom. It doesn't matter what your title is, what your position is in the organization. The policies applied to everyone equally, and we expected everyone to follow them. So very important there. So stepping into response protocols, right? Having a defined process for handling positive cases. You know, having what's our contact tracing protocol? What do we do when somebody tests positive? And you know, I could guarantee you we were going to have positive cases throughout the year. Much as we tried not to have any, it's inevitable that you're going to have them, and you will probably have them in your organization once you return. They still happen, although if you look at the numbers now for our region, you know, we're down to less than 5% positivity test rate, which is below community transmission thresholds. So that's a good number for us to be at. And we've been that way for 2 weeks in the region. So things are definitely looking better for us, but you still have to be on guard because it could spike up at any time. So we don't want to get complacent at this point in time. You know, that positive case thing, what's your quarantine? Quarantine people is needed. You have to be prepared to do that. And your employees need to know what that process is. It will make them feel a whole lot more comfortable about coming to work if they know, look, if you've been in close contact with somebody that's positive, we're not going to tell you who it is, but we're going to tell you and talk to you about it and tell you what you need to do. So that, and our employees were very clear on that scenario. Always maintain privacy of infected individuals. HIPAA, as Christy mentioned earlier, was really important to our decision process. And that was just a no-brainer. We had to do that because it's policy, and we wanted to respect people's privacy. As we said as well, when we built our policies, you know, we're referring to CDC or State Health Department for guidance on those policies. Those are rapidly changing. I remember the first few months, Christy or I, or both of us, were spending hours every day combing over these changes and what changed, and you would see the website. It was like, that's not what it said yesterday, right? But there was no notation of what had changed. So you really had to be looking at it regular and kind of having notes about what was going on. The other thing we did that was important when we published protocols to employees, we always referenced back to this website, or this is where we got these guidelines from. So employees knew we weren't just making stuff up because we wanted to. We were referring to guidance that was being published by public entities, and our stuff was based on that guidance and not just something we were making up. So, a good example of that, initial contact tracing, when it first started, you had to look back 10 days, and then it went to 7 days, and then it went to 72 hours. So that was a big help. Oh, I got to look back 3 days. Currently, it's now 48 hours. So it's much easier to do contact tracing. If you have somebody that comes in the office Monday and they leave at noon, I'm not feeling well, and then you find out, oh, I tested positive for COVID. Okay, when did you start showing symptoms? Monday afternoon. Okay, well, you'll need to look back Sunday and Saturday. What's a weekend? Are we concerned? Well, hey, coworkers are friends sometimes outside of work, and so maybe they were hanging out with coworkers over the weekend. So, but you have to do that contact tracing. It's a lot easier than it used to be.
Yeah, and I would say early on, and this may be applicable to some of you that haven't returned at all, there was some distrust that we weren't doing thorough investigation. And so it was through regular communication, open to all of the questions, talking to anybody that thought, well, I worked near that person, and really being receptive to their concerns, helped them realize that we were consistently applying a contact tracing policy, and that if you were contacted by me, that there was some level of exposure. Here's our standard process. If you were not, and you called me concerned, I would explain why. And we built some trust over time with that regular communication. I can't stress communication enough, because we needed our employees to trust us that we were doing our due diligence and doing right by the employee, and keeping those that could work working, and quarantining those that could pose a risk.
Yeah, absolutely. And I think, to that end, there's a phrase that we dealt with a lot in terms of infection, and how you respond to it when you had a positive case. And that was the whole context of context scenario. And I think it took us a while to get our employees educated on it. That's a context of context, a situation. What does that mean? Well, if you were sitting next to somebody who was living with someone that was positive, that doesn't mean you're at really any greater risk of having contracted COVID, because the individual you were sitting next to was not positive. And so it's a context of context situation. It took us a while to get our employees to understand that concept, but eventually when someone say, oh, do I need to be worried? Am I at risk? No, you're in the context of, oh, okay, got it. And the employees knew, and that was through repeated communications with a definition of what is context of context, and why is that not a heightened risk for an employee to be in that situation.
And we needed to understand it. We needed to understand it
Absolutely.
well, so that we could educate the employee on it. We have had far more concerns that resulted in context of contacts, where if we didn't understand what that term means, write that down as a homework item, we would have significantly more employees quarantined than were probably necessary. So that was a really important one.
Absolutely. And the final thing I would say on response protocols, right? We used established public health guidelines to protect the company from potential litigation. So I can't stress enough basing your decisions based on what's publicly available, what the health guidelines are that are out there. In our mind, you really can't go wrong defending your business if you're following accepted general standards of practice. And when you're dealing with your employees, you're safe, your business is safe there in that scenario.
When we would say, and we had some conversations, that sometimes the decisions that we needed to make in response protocol needed to be employee first. Where if it was a business decision, we would maybe want people to return more quickly, right? Because we want business to move forward. We had to holistically look at what was going on and balance those things to make sure that we still had employees that felt safe and felt that we were concerned about them to continue working.
So we're running a little bit long, so let's wrap this up really quickly here. So what we're trying to say here is you can open your office safely, right? We know you can do it. We've done it for the last year, so it is possible. Communication and clearly defined policies are the keys to opening your office safely. And you got to remain flexible to deal with current conditions. If we have another spike, we're prepared to deal with that in whatever way that may be necessary. The other thing we recommend is if you have not gone back to work yet, or even if you're partially open, which we know a good number of you are, is conduct a survey of your employees and focus on these types of areas. How do they feel about workplace safety? What do they expect when they come back to the office? How are they feeling right now? Are they fatigued at being at home? Are they clamoring to get out of the office? I've heard from other people, it's like, if I have to work from home for another week, I'm going to end up divorced. My wife's sick of me, right? And I'm sick of her, right? That close quarter stuff is getting on everybody's nerves. Well, what is an employee's remote working situation? Some people will say, I don't ever want to get back to the office. I have a great place to work at home. I'm comfortable working there. It's easier for me, and they want to do that. So understanding that from your workforce. Those that are dealing with childcare or elderly care, right? What are those situations? Transportation challenges, not so much an issue in our region because we don't have a lot of public transportation, but you can imagine people on the East Coast or larger cities that have mass transit, that have subways, and a lot of employees use that to transfer. How is that going to work in the age of COVID? You can imagine being in New York City now to deal with that challenge. Even today, it's still a challenge. And then your team management. How is your team currently being managed? Can it continue to function in this environment, right? Mm-hmm. And then ask open-ended questions in your survey. Tell your employees, tell me what you need. What are your concerns? So, because you're not going to know everything that your employees are thinking. It's impossible to. So the other thing I would say is we do have a couple other sessions coming up that will have a deeper dive on actual technologies that we use. So the next one is April 14th at 2:00, and it's focused on building technologies for a healthy workplace. And we will provide more details on that in the invite. And then April 28th at 2, we're doing one on updating your conference rooms to support the hybrid workforce. One of the things we know that's going to happen is it's probably very rare that you're ever going to have another meeting where you don't have someone that is remote attending that, even an internal meeting. So are your conference rooms up to speed to handle whatever platform you ended up adopting, whether that was Teams or Zoom or WebEx or GoToMeeting or one of these other platforms? Are your rooms prepared? And you can actually do it quite cost effectively. So we'll have a deeper dive on that. And if you attend one of those sessions, you'll get a free, no obligation consultation with a solution architect to discuss those potential options and what might help you prepare your office for the return. So with that, we'll step into questions and answers. So,
okay, I think we have one. First one is, so what is the BCP and how do you suggest developing one?
Sure. So business continuity plan, right? I think there's a lot of resources available online, especially for smaller businesses that maybe didn't think they ever needed a business continuity plan. I know when we first started, we didn't have that vision. As we grew, we realized we reached a point where we need to have a business continuity plan. And so there are resources available online. There's a lot of resources available for developing a business continuity plan. So I encourage you to look for those. I'm happy to share some additional. If you have questions, you'll have an opportunity in the survey to request some additional information to talk to you about that. There are defined caveats to, what is in that BCP plan, how detailed does it need to be for your business, and what are you looking to achieve in that?
Okay. Okay.
And a quick reminder to everyone, if you'd like to put in a Q&A, there is that Q&A box down in the bottom right corner. Just click it and enter your question, and we'll be happy to answer it.
Thanks.
Good. So one is, how do you make your employees return to work who refuse?
I think I'm going to leave that one to HR. So, Christy, you want to address that one?
So we talked a little bit about over some of those things, right? Start with an overarching policy or guideline with what your expectations are with your employees, and then allow for the deeper conversation with that individual who says, well, I'm not returning back to work. Is it out of fear, or is there a true circumstance that may physically limit them to returning to the office, right? And that there is going to tell you what your next steps are. Do you need to work to accommodate that person, or do you talk through with the individual, let them know that the job function and what it takes to get the job done needs to be in the office, and hopefully you can work through some of those things. Ultimately, if you're not putting the employee at any extreme risk and it's not a part of the job, then if they do not want to return to work, ultimately that is their choice. But the goal of everything that we've done and talked about is to make sure that employees feel safe so that they are willing and able to return back to the office. So you do all of the steps of, before with the communication and the active engagement and listening. Hopefully you have less of those refusing to return to work.
Sure.
Yeah.
Okay.
One's about infection prevention protocol. Do you have a documented plan, or what did you do there?
Yeah, we did. We do have written documents. Those are things that we developed in the COVID team, and we would publish those kind of weekly as reminders, especially early on in the weekly email notifications. There were always steps about what are our infection prevention protocols, right? These are things that employees are expected to do, whether that be, you've got to wear a mask when you enter the building, you got to sanitize your hands when you first enter the building, and then we expect you to do it throughout the day. Part of that is us providing those supplies to employees to enable them to be able to do those things. But having a documented policy that refers back to public guidelines when it comes to health and safety were really important to us. So, yeah, having it written down is important. Employees appreciate that. They know that you're just not making stuff up on the fly for what you expect them to do. So,
and then the last one, what's your plan for jobs that cannot socially distance while performing their job?
Yeah, that's a good question, and that is something that we faced throughout the last year. We have certain job tests, especially out of construction sites, where we may have individuals that are working. I'll use some of our cabling technicians as a great example. They'd be working in an IT closet in close proximity to one another, and it requires multiple people sometimes to achieve that task working in close contact. So those guys were very aware of each other's safety and the responsibility they had to their coworker, because they didn't want to be the one that put a team out of work for a week because people had to quarantine and didn't have an income. So they were very cognizant about, I'm going to stay home if I'm sick, or I'm going to communicate. And then they also did a very good job of wearing PPE, whether that's face masks, gloves when necessary. Even our field guys developed a protocol. They brought it up early on about, well, we share tools. What are we supposed to do? And we're not talking about screwdrivers and small things. We're talking about power tools that are expensive items that everybody doesn't just have their own personal bandsaw or things like that. So they developed a procedure for wiping it down and sanitizing the device before the next person picked it up. And they worked closely together to ensure each other's safety. And that's, again, where I come back to you. I can't commend our workforce enough for being proactive and really seriously taking each other's health and concern into consideration as they work throughout the day. So you will have job roles that requires it. Talk to the employees and trust them to do the right thing. And we had employees that I don't feel comfortable. Well, I saw so-and-so up walking around without a mask today, and they walked right by my desk. And so occasionally you have to remind the employee, hey, you're violating policy here. You're making other people uncomfortable by what you're doing. So make sure you're following the guidelines. So
that's it.
That's it.
That concludes our session for today. Thank you to John and Christy for your time and a great presentation, and thank you all for joining us. Have a great rest of your day.